All right, welcome back, everybody. I've just been getting a flurry of text messages in that we're having some internet issues. The power is out in some areas here. So I'm actually very happy to announce that both Christine and I will be co-hosting this event. Brandy Winquist will be trying to call in as quickly as possible, but I am going to turn it over to the co-host, co-lead for the Research Showcase 2020, Christine Stobart from the Saskatchewan Centre for Patient-Oriented Research, for a land acknowledgement and a few opening comments. Christine?
Yep. Welcome, everyone. We're so glad that you could attend Accessing Health Data in Saskatchewan, what you need to know about current and future opportunities. It's great to have you all with us. I want to just open with a few opening housekeeping tips. One, we ask that you keep your mics off during the presentation, although you're more than welcome to keep your cameras on. The chat box is being monitored by an IT specialist, and we also will be moderating. The moderator will also be following the chat box as well. The session will be recorded. If you're having problems connecting to Zoom audio or your camera, there is a tech support, and the number is in the chat box. Questions can be written in the chat box to be addressed, or hands can be raised to ask questions. When asking a question, please introduce yourself and where you're from. Speak loudly and clearly. And just a reminder that following the end of Showcase, all attendees will receive a survey, and we ask everyone to please take time to complete the evaluation because the feedback is invaluable to us. Before I turn it over to our presenters, I'd like to begin in the spirit of reciprocity and truth. I'd like to honor and acknowledge that I am situated on Treaty 6 territory in the homeland of the Métis. I'd like to pay my respect to the ancestors of this place and reaffirm our relationship with all nations and peoples of this land. So on that note, I'm going to turn it over to our presenters. I believe we have Meriç with us, and I think he has a slide deck. So if you can share the slide deck with us, that would be terrific. And we'll turn it over to you.
Thank you so much, Christine. Can you guys hear me clearly?
Yep, perfectly. Thanks, Meriç.
Yep.
And I'm assuming you guys can see my screen as well.
Yes, we can.
Perfect. Well, let's start. My name is Meriç Osman, and I'm the co-lead for the SCPOR Data and Data Services platform. And Scott Wells, also the co-lead of the Data and Data Services platform, is here with us today, and we're going to co-present the data infrastructure development, a journey that we have been through for a couple of years, and really have an open dialogue after this presentation is our goal. But again, thank you so much for being here with us. It is a lovely afternoon in Saskatchewan, and I'm joining this presentation from Saskatoon, which is also located at Treaty 6. So what are we going to do today is, well, even thinking about that this is the third day of our research showcase, a successful event. So far, I'm loving it. This is the agenda that I would like to go through, but I'm not going to spend so much time on what SCPOR is. A couple of slides there, but really what I would like to share with you is the journey that we have been through, as I have mentioned, a couple of years regarding the establishment, development of a data infrastructure in our province. And also, as we are going to this journey, I would like to relate a couple pieces to many of our journey as researchers. And when I say ours, in heart and in my mind, I'm a researcher, and would like to go through with that. And really, given those two inputs that I will share with you, I would like to go over what is the plan that we are planning to establish going forward, and what are those pieces that really addresses the things that we have heard through our engagement and through the journey that we know you guys are all going through. And last but not least, I'm going to a little bit talk about SCPOR 2.0, and what it is really the next, fingers crossed, next grant to continue SCPOR into further years. Starting with SCPOR, SCPOR is a partnership of 8 organizations in our province, and you can see on our screen, and which is established as a response to Canadian Institute of Health Research strategy for patient-oriented research initiative across Canada. Our purpose, in my words, is to create an environment to cultivate, improve, and support patient-oriented research to impact the healthcare policy and delivery in Saskatchewan. And our journey of SCPOR 1.0 has started in 2015, and to date we have supported numerous patient-oriented research projects across Saskatchewan, including the projects that have received supports from the Data and Data Services platform. I have mentioned I would like to talk about the journey that we have went through, and I have 2 kids, and my daughter is 6.5, and a couple weeks ago, I have convinced her to read The Hobbit with me. So I celebrated. I'm looking forward to our journey together with her, and we are right in the Riddles in the Dark piece, which is one of my favorite sections in the book. So if you haven't read it, please give it a try. But as I was thinking this presentation and the journey that we have went through, I think it relates. It relates to the book that I'm reading with my daughter, but also really there are pieces that resonated with me. So I just wanted to mention about that. And when we talk about the data infrastructure development and that journey, it is a big undertaking. And with all honesty, we had some rocky starts in the beginning, internal and external factors, and one of them being the amalgamation of our health regions into one single health authority. But that now is our biggest ally, and really moving forward, we are continuing starting this journey in the right way, in a collaboration spirit. So our journey, by the way, when you guys, as you guys see my screen, do you guys see the camera as kind of graded area, or you guys can fully see my screen? Okay, all right. You guys can see my screen, perfect. I would like to start with the engagement and visioning pieces that we have started, with how we started to develop our journey, and how do we, what was our approach. So we wanted to start by engaging with all our partner organizations, but especially with researchers and patient partners, really to understand the current state that they're in with regards to data and analytics in our province. During these engagement sessions, we have done multiple of them. We have talked about their top priorities when it comes to data and analytics, and wanted to learn more about what are the main functions they're using to complete these priorities, but also what are the main barriers that they're facing each and every day when they're trying to finish those tasks. And last but not least, what we wanted to do was to do some blue sky thinking, thinking about the ideal future state that each organization and each group, each stakeholders are envisioning. We have collated all this information that we gathered through these individual engagement sessions and brought everyone into a room, and as no surprise to any of us, I guess, is that that's one of the best ways to get a decision. If you want to put multiple people in one room for a day, it was a great experience for us as well. And then in that visioning day, the attendees were the key decision makers in our system. Our session has been opened by one of our patient partners, and also researchers were in the attendance as well. Through that day, we have done a brainstorming, and below are the next slide that I will show you is the focus areas that as a province we have decided to work together to improve. So those pieces, I'm going to go specifically into detail, but really at a high level, we acknowledge that we need a data literacy we have to improve around the data literacy. And what I mean by that is really we thought about building a data literacy program that will allow learning and understanding of data at all levels of the health system, including senior leaders, analysts, researchers, clinician researchers, patient partners. And acknowledging that each stakeholder who will be engaging these data literacy program will have different needs when it comes to the data. Some decision makers would like to see what are the interpretations of the data that we're getting from it. However, as researchers, we would like to understand, maybe to the nitty-gritty detail of the databases that we're engaging with. And we acknowledge that we do not have a resource, such a centralized resource in our province. We know a great deal about our data and our data assets in the province, but the thing that we have identified that that information being siloed in different locations within different organizations. The second piece was really around data governance. And I think in my own words, this entails everything from how we standardize, how we collect, how we store, how we provide access, and how we maintain our provincial data assets. And if I may relate to maybe the theme of this presentation or the things that I've been sharing, basically, probably this is the closest thing that is the ring that really rules them all. And last but not least, the data infrastructure. We talked about leveraging and enhancing the available tools and technologies to improve access for multiple purposes to databases in Saskatchewan, and from research to operations, and of course, adhering the security and also the privacy protected those parameters, of course. So those were the discussions that we had, and that is one of the inputs that we had in our hands, really as a provincial perspective, the things that we need to improve. And thinking about what our researchers are going through and what is the journey really for when we talk about the data access. We also layered that information on top of the information that we gathered as from a provincial perspective. Really what we think about is that, well, as researchers, we find an idea. We have a hypothesis, and we want to answer them using multiple resources. But one of the first things that in an ideal world, and that was one of the things that came out from our engagement sessions with our researchers, is that really knowledge about the databases, knowledge about the availability of the data assets. And really the first question is this: okay, I have this question. Is there a way, or are there any resources that I can answer those questions? And of course, primary data collection can be set aside for this purpose. So once we know the availability, the second piece comes that, okay, so it looks like the databases are available for me to answer my question. So how do I request? So where does that process start? That I can request in a timely manner and given access to these databases for the purposes of my research. And then the journey continues. And it comes to around the data linkage. And what I mean here is that thinking about the research and thinking about especially health research, it starts with birth, maybe even earlier, and then really goes to death. So really, sometimes the questions that we have in mind may not be answered by a single database. So really, what we need to do is compile information from different databases and then link them in a meaningful way to answer our questions. I put a question mark there, thinking about maybe some research pieces may not entail this piece. But lastly is the data access, and then I put a party there that we have the access, the database. As researchers, we do our analysis and then get our inference from the question from those databases. So this is an ideal world journey for our researchers, and I'm happy that we are in a virtual environment that if I missed anything, you can't throw anything to me, but you can ask me the question if I missed anything. However, when we think about the reality, here are the barriers that are identified also with our engagement with our research partners and our patient partners, but also at the provincial level as well. There's no resource really as centralized as our researchers to look at, to understand what are the databases that are available. And I'll come to that point, because when we talk about databases, it is an ocean, and then we might need to prioritize what it is that we are looking for. And when it comes to request, again, similarly, is that we know as the organizations are multiple siloed, maybe we know a greater deal about our databases, but then request processes can be really confusing for our researchers, thinking about what is the database that I need and how and where shall I request these pieces. So we understand, and that was one of the other pieces that came and identified as a barrier as well. And in terms of data linkages, once the data access is happening to an individual database or the data resource, we know that when we want to link multiple resources, it takes time. There's multiple agreements has to be in place, and it takes really a great deal amount of time to complete the research questions that we have hand, so that it can be timely utilized to direct policy. But also it may or may not fit our grant timelines that our researchers we receive. So one of the other pieces that we have identified are really the bottleneck there in terms of when we want to link multiple resources. So what is the way to go with it? And last but not least is around access. And we understand those pieces in terms of access being relatively good comparably with some jurisdictions, but also there's so much more growth that can be done on that front. So that was the other piece that came through with our engagement with our researchers. So the next slide, as I have mentioned in the agenda, is really thinks about or talks about the integrated plan. And integrated meaning two things in that level is that number one, it's integrated, that it really tries to address all those pieces as you see as in a spectrum and a continuum that is relates to our researchers' journey. But also it's integrated in a way that multiple organizations is and will be working towards them to address these issues. So our integrated plan really include this at a high level, and I'm glad to answer any questions in the best way I can. Is starting with the establishment of a data literacy program, to addressing the first barrier that probably our researchers are facing. As I have said, when we talk about what we are envisioning to start is that when we talk about data assets, databases, is in a provincial landscape, it is an ocean. So what we are trying to do at this point is really to understand what are the particular data assets in the province that are used frequently for research purposes, and then create overview of these databases. And what I mean here is what is included in this database, from its limitations to the years that are available and all those details that we are hoping that we will be making available in an accessible way for our researchers and anyone that really want to engage with that program. We are envisioning to have orientation and multiple training pieces, and this is, how we engage with these. If it's an administrative health database, for instance, that is one of the frequently utilized ones, how we engage with these databases, what are the things that we should be careful about, and also from privacy and security perspectives, what are the things that we are thinking. Last but not least, one of our vision is to create, and we hope that this will be helpful for our researchers, and we have heard this multiple times, is to create an opportunities for hands-on training. And what we mean here is that maybe there will be training fake simulated databases that our researchers can go in and understand the databases, how they're structured, but also to see whether they are there for to answer the questions they have. Furthermore, maybe there will be efficiency gains, in terms of code development and other pieces that as the excess time that we are waiting, we can find efficiencies in that front. The second piece relates to the journey, and everything that we have heard is really around streamline access and also the data sharing processes. And what we are really envisioning at this point is that is really to clear the confusion in terms of where and how, as a researcher, I can request to get access to these databases, and we really want to streamline that process and really create a clear process for research intake and requests. and the goals would be around improving timelines, and this is similarly goes with the data sharing processes, is the question at hand is that can we have really frameworks or some pieces around that we can look at the request and then really expedite that process and then make these linkages not cumbersome but really efficient and effective, so that we improve the research capacity in Saskatchewan. And also everything, when we talk about the access and data sharing pieces, it all is within the umbrella, and that's our priority really, is to keep this security measures in place and also protect the privacy of our data. And I will pass the mic to you, Scott, for you to talk about the data infrastructure.
Sounds good. Thanks, Meriç. Good afternoon, folks. So really what I want to talk about a little bit today, and kind of the area that I focus on kind of co-leading the data platform for SCPOR, is really around the infrastructure. And I think one of the main questions, comments, concerns that we get from the research side of things is, you know, there's a lot of other infrastructure and availability of tools, technology from different jurisdictions, and you know, why isn't that available here, and those kinds of things. And so that is a piece that we're diligently working on right now, looking at the lessons learned from some of the other jurisdictions and what other organizations are doing from this respect to provide access to the information. Obviously it is related to some privacy constraints as well, but making sure that we develop the infrastructure so as we move forward, we do have that available, and we can make sure that folks can get access to data as it does become available. Where we're at right now is really kind of in the initial consultation period. And so we've been, as Meriç was saying, we've been working with some researchers, but we've also been working with a lot of the healthcare organizations. So from the SHA, Ministry of Health, and a number at SAS Cancer and a number of other organizations, in order to work through kind of the framework for how do we set this up, what makes sense from security, privacy, all of those other pieces. And so really right now, what I would suggest is we don't have a lot more for you on this other than it's in development. We're working through these pieces, and we hope to have more to share soon. Folks may or may not be aware that provincially there is a data and analytics oversight group with partnership from many of the same organizations that are partners in SCPOR, but really that's to provide some direction provincially for data and analytics. And so this is an area that as well, that provincial oversight group is looking at as well, and how do we enable the infrastructure, tools, and technology to support this. So more to come on this, but an exciting area that we're working through right now.
Thank you, Scott. And I think one of the other things that I would like to mention is the next phase of our of SCPOR, which we name it SCPOR 2.0. And in our research showcase, this concept of learning health system, and I don't think many of you are strangers to the concept, is mentioned a lot. And SCPOR 2.0 is really will be focusing on establishment of a learning health system in our province, and really find those efficiencies from practice to data. How do we collect the data? What are those pieces that, as Scott has talked, in terms of needed for access, and what are the supports and the things that we turn that data into knowledge, and through implementation science, how do we implement those learnings that we have in our province to the direct care of our patients. And that is an exciting piece, but really all the work that I have shared with you, as Scott has mentioned, we have some pieces are already in the move. We are working with multiple organizations to move, for instance, the data literacy program forward. We are trying to find those pieces, what makes sense for our researchers. But yesterday, one of the things that I think Sterling Bryan has shared with us, that the data is really a prerequisite, or maybe a efficient data area is prerequisite for a successful learning health system. And really that is one of the key pieces that our work now is going to hopefully improve the current state, and also will enable us for a great learning health system establishment in Saskatchewan. And within the SCPOR 2.0, and I will, this presentation and this workshop actually, we have my colleagues from CAIHI and Canadian Data Platform to share with us that there will be exciting national and also local collaborations going forward. We don't have a timeline when SCPOR 2.0 is coming to us. However, our grant application will be going very soon, so we are estimating that we're hoping that we will hear our start will be somewhere in fiscal year 21-22. And one of the other things that I would like to share is that everything that you guys have seen today is not being done in a separation. It's not being done on siloed pieces. We really want to hear from you. And the right-hand side, that barcode is, if you have smartphones or if your smart devices at this point, please scan it. And it will take you through a data literacy needs assessment tool, a survey. And even if that is really focused on data literacy, it really talks about there are open pieces that our researchers, and we are looking forward to hear from you around the needs and barriers around data and analytics. So we wanna hear more from you. We wanna do this together. If you don't have a smart device at this point, please feel free to send an email to my colleague Osman, so that she can share with the link with you through email. And as I will conclude my presentation at this point, what I would like to say is that this is my last day as the co-lead of the data and the data platform at SCPOR. It has been a privilege and honor to work with all the researchers and the staff to really improve these meaningful pieces forward. And Bilis is the new co-lead that will be overseeing this work along with Scott. So this is what we wanted to share with you at this point. And Elan, Christine, I don't know, however whatever the preference is, that we can have questions at this point or at the end, depending on how we want to run it. Elan,
why don't you take questions right now, and then we will move on to the next presenter.
Of course.
And thank you, Christina. Before we do that, I'm not sure, and if I missed it, then you can put me into a breakout room and make me sit by myself for a timeout. But I'm not sure, because we're missing our moderator, our formal. Scott, can you act? I'm not sure you've had a great introduction on who you are and what your role is within Saskatchewan Health Data. Would you just take a few moments just to formally introduce yourself after that great presentation?
Well, I apologize for that, Elan. So Scott Wells, I kind of wear two hats, or maybe three, I guess. So one, I'm the co-lead of the data platform with Meriç, or now Belize. As well, kind of my other day job is the Director of Information and Analytics Services at eHealth Saskatchewan. And so we provide kind of a lot of central services for data and analytics to kind of health system partners, but also for research as well. So that's one of the pieces there. And then as well, I do sit on the data and analytics oversight group, so the provincial group for data and analytics. So that's a little bit about me. And I do see there was a question that really came in kind of around that piece. And so maybe just to kind of answer that, I think that's one of the pieces right now. And sorry for folks that maybe don't see the question. It's really around how do we facilitate, how do folks get access, maybe during data management and analysis, explain a little bit more about how we can get this done better. So right now, I think some of the processes that we have out there for the research community, they're siloed, they're disparate, and we're not exactly sure, or lots of folks maybe aren't sure exactly how that works. So for right now, I think that's the process that Meriç and I were working through, as well as now Belize and some of the other folks in healthcare, to figure that out. In the interim, if there are questions, I know my information is on the screen now, but by all means, get in touch with myself or Belize if you do have questions about any other supports that are out there. Today, we actually do support, if any research request comes in, we will facilitate getting support for access to data or understanding what data is available. In most cases, it probably does come to either my team or someone at the ministry or the SHA in order to kind of dig through that. So if you do need help and support on that, by all means, you know, let me know on that.
Thanks, Scott. We have a couple of great questions coming into here as well. I'm going to ask that we open up the microphone for Kevin Belitsky for his question.
Hi there, sorry for the delay. I'm just finishing up my late lunch. But Scott, I was just wondering if you were aware of any patient and family partner representation on the governance committee?
So we did have a patient family representative. I think it was up until, well, it's been more than a couple of months ago. They had to leave their position. So there was someone on DAOG or the governance, and we are looking for someone to replace that. So we've got to go through that process right now. Okay, great, thanks.
And Marilyn Kinlock.
Hi. Scott, it's nice to meet you. Sometimes I think some of us that are working for the SHA think that eHealth is a large conglomerate, and it's nice always to put a face to that. Some of the things, like we obviously have our own projects and goals that we align with, and sometimes we get met back with, eHealth doesn't want to deal with this right now. They've got enough going on with COVID. Are you relatively protected and siloed in your work, and it's continuing on as uninterrupted?
Yeah, there's a couple of pieces to that. And it depending on kind of what you're looking for and what you need support in. I think there's certain areas and certain teams within eHealth, especially on the technology deployment side. So things like the groups doing contact tracing or the systems associated with that. They've had a lot of really big technical needs that have gone on. So from that side, there are some of those teams that, you know, we're probably a little bit more hands-off. My team, and so again, it's really more on the data and analytics side or supporting, you know, research. We still are open to things, and we have been supporting whether it's the SHA ministry or otherwise through all of this. And so, yeah, absolutely. If there are ways that we can support, I'm not going to guarantee a timeline on some of these because it does depend on kind of what's going on with COVID and what the flavor of the day is, but we can at least kind of put it into the queue, facilitate what needs to be done, and help where we can.
Great. We have another, I think, a really good question from Sandy Kasser, but I'm going to save that because she's asking about what resources are there for the novice researcher. And I don't know if we can answer that question adequately until we get to the end of our panel presentation. So Sandy, hang on there, please resubmit. And I think we'll move on. Our next presenter is Juliana Wu. And I will get you to turn the screen over to yourself and introduce yourself to all of our attendees today.
Sure, thank you. I hope you can see my screen now. Is that everything okay? Yeah.
We do. Yep, all is great.
Let's see. I'm going to turn it to slideshow mode. Great. So hello, everyone. Thank you for having me. My name is Juliana. I'm the lead for the Health Data Research Network Canada for the Data Access Support Hub, which I'll speak to quite a bit during this presentation. As well, I also wear a separate hat at the Canadian Institute for Health Information. At CIHI, I am the manager for the Corporate Data Access Program and Decision Support Services. So I was responsible for any kind of researcher requests that may came through to CIHI for the CIHI extensive data holdings. You'll see that Joe is also on the panel, Joe Strachan. We are colleagues at CIHI, and while my talk is going to focus on the HDRN work and CIHI's role within the HDRN, Joe will be speaking to specific products and services at CIHI. So we're essentially tag teaming a little bit on our presentations. So I'll get started with a little bit of background around HDRN Canada. I'm not sure how familiar this group is with this network, but essentially it's a network of centers across the country. There's provincial, territorial organizations, as well as pan-Canadian organizations that essentially just came together a couple years ago, you know, wanting to look at how we can get together, work together, and share our expertise in thinking of ways to make research easier for Canada. We know that there's many challenges, and we'll get into that a little bit in terms of data access, managing timelines, managing privacy and legislative requirements. And the network really kind of came together a couple of years ago when several representatives from the organizations came together and say, you know, what can we do together to help things become a little bit easier for the research community? So in terms of the network, here on the screen, you'll see is the membership of the network to date. So you'll see it's really a span of organizations across the country. These are all data centers that host data assets. Many of them are provincially located. So for instance, ICES and Population Data BC would be holding the BC specific or Ontario specific data assets. And then we have the pan-Canadian organizations such as CIHI and Statistics Canada, who can also provide the multi-jurisdictional data holdings that we each hold in our organization. You'll see that in Meriç, you know, we've worked with Meriç, we had work with Health Quality Council in terms of Saskatchewan being active members within this network as well. And really a lot of the value of this network is leveraging some of the existing relationships that each of these organizations already have with our respective ministries of health, with our federal partners, and also other local data providers and local organizations, right? And it's really the strength is in leveraging kind of those existing relationships and existing processes. So I guess, you know, speaking to challenges for health data research in Canada, I think, you know, many of you may have been familiar to this. So what we have recognized very early on is that, you know, a lot of times research work in Canada is restricted to within the provinces, right? And largely because, you know, sharing of data across provincial boundaries is very challenging. There's many kind of both legislative and real barriers, as well as perceived barriers in terms of kind of either sharing data across jurisdictions or pooling data into one location. Those have been recognized as very difficult to do. So essentially that ended up with being, you know, with the situation where people are trying to do their best in terms of pulling the data within the provinces, do their work as best as they can within the province. But a lot of times data are captured, defined, and analyzed differently across the jurisdictions, right? So it's very challenging to get a maybe almost like a pan-Canadian view in terms of some of the research questions that people would like to tackle. So what the network is really about is a distributed network that wanting to facilitate and accelerate multi-jurisdictional research. And of course, as I mentioned, you know, within CIHI, we have over 28 data holdings that are pan-Canadian in nature. But beyond the data holdings that we have CIHI, a lot of the data resides in the provincial data centers, and they are province specific, right? So if you're a researcher who's looking to do research work, say in Ontario, Alberta, and Saskatchewan, you're looking at, for instance, cancer registry data or immigration data, that kind of information is not available at CIHI. And how can we help researchers kind of get through you know, navigate that journey in terms of knocking on doors of multiple organizations, trying to figure your way out in terms of how to get access to all these pieces of data. So I think that the working principle for the network is that, you know, we have strong starting point, like, you know, leveraging, like I mentioned before, this network of provincial data centers who within ourselves already have a wide set of data assets available through our organizations. We wanted to, and we have strong experience within kind of the local context, the local policy and process requirements. And so ideally is we can provide a place where researchers can come and we can help people kind of get through that journey, help people figure out what is required in each of the jurisdictions. And also over time, as we work together, ideally, each organizations can also learn from each other, right? Because we recognize that the processes are different, requirements are different at the moment, but there's opportunity to harmonize and help ourselves converge in terms of how we do things across the country. So on this slide is, you know, 7 objectives that the Health Data Research Network Canada has set out to wanting to accomplish in the next couple of years. So you can see that I'm not going to go through each of those, but I think very relevant to this group in particular for the research community in Saskatchewan is, you know, a couple pieces, right? The first piece being the data access support system. So how can we support researchers in getting at the data that they need in a, you know, efficient and timely way, as timely as efficient as they can. The second point is about harmonizing definitions and algorithms, right? So even if you can get at the data needs to be comparable, needs to be usable and easy to use in analysis. So there's also effort within the network to say, well, how can we come up with some common algorithms for typical, for a lot of diseases that people typically want to study, or social determinants of health? Is there ways that we can catalog and start looking at harmonizing some of these definitions and these algorithms? We also want to look at expanding sources and types of data. So each of our network's data centers, have our own data advancement strategy. So for instance, CIHI is looking continuously to expand the data assets that we have holding in our organization so that we can do the work that we do. But as well, like other data centers within the network, ICS, POP data, they're continuously also trying to acquire new types of data so that over time, the data assets that can be available through this network would expand and would grow, right? So for example, nowadays, people are very interested in social data or race or ethnicity driven type data, right? So those are things that collectively as a network, we're hoping to kind of expand on and provide access to. And the other thing I wanted to highlight here is also partnerships. So, of course, continuously engaging with patients, public, Indigenous communities. In particular, this network is quite focused in patient engagement and public engagement as well, is to ensure that the public has a good sense of how we're using their data, like having that continuous dialogue about their health data, how are their data being used and how their data being responsibly kind of taken care of, right, while we do our analysis and providing the access. So these are kind of the high level objectives that the network set out to do. So I would say that on this slide is some of the key milestones that the network have kind of accomplished to date. So a lot of this work really kind of got in motion when we, as a network, submitted a grant proposal to CIHR to build and operate the SCPOR Canadian data platform. And we are, very grateful to be granted to this work. So it was a 7-year grant from CIHR as well as the organizations to develop this platform. So really, formally, the work started in April last year. So it's been about 18 months. And in the last 18 months, we have really developed and implemented the DASH, or the Data Access Support Hub, which I'll speak to in a minute. And we also incorporated ourselves as a nonprofit organization. We have a website set up that we hope can immediately, provide some value and some benefits to the research community. And like I mentioned, this is a 7-year grant, so we do have some time in terms of the short-term goals and the longer-term goals as well. And I'll speak to some of that. So maybe a little bit on the Data Access Support Hub. So I would say the Data Access Support Hub, or we call it DASH, is the first, I would say, the flagship product or service that came out of HDR in Canada. It was it was officially launched back in February this year, so it's only been a few months. But essentially, this is where we wanted to provide a single place or one-stop portal for researchers like yourself who are interested in accessing pan-Canadian data to go to, right? So like I mentioned before, if you're a researcher who's looking at multiple, like 4 or 5 provinces of data, prior to DASH, what you had to do is to go to the ICS, go to eHealth, go to POP data and figure out on your own what process, what paperwork, what kind of timeline you're going to work with, what kind of contract you need to get into. The service that DASH provides is, as a researcher, you can come to DASH. This is one point of contact for you. And then in the back end, we'll be coordinating, these responses for you. So essentially, DASH is led by a multi-jurisdictional, multi-center team. It's led by the Canadian Institute for Health Information, hence my role, my double hat in terms of my role at CIHI and also leading this work. But with CIHI leading the team is actually made up of staff that are distributed within the provincial data centers as well as Staff Canada and CIHI. So there's distributed staff embedded in these data centers so that when a research or request or an inquiry comes in, CIHI would lead that process of responding to these inquiries by consulting with our distributed staff, right, to understand what is required, how, as a team together work through feasibility of a certain request, develop cost estimates for that request, and over time be able to help the researcher navigate through the process across the different centers. So all that to say is, and I think that the key theme to this network and to the DASH principle is also that it's still distributed in a sense that we don't have one organization that processes all your requests. Like your requests will still be processed by each of the member centers, but the support that you will get, the communication you get, and the coordination or responses that you'll get will be coordinated across the centers. So at the moment, we think this should be able to provide some benefits to the researchers, because we know that local processes is not something we can change over time. We can't change things in 2 years in terms of how BC does things, how Ontario does things, but we can at least help researchers navigate through these complex and at times look very different processes. So that's really what DASH is about. So here are some objectives, like I mentioned. One is to make local process more transparent, provide coordinated support. And increasingly, we're finding even in this early increase that we've gotten in the DASH, we realize that there's a lot of data sharing issues. And you know, a lot of times the research community may not be aware that these type of issues were present at the time of study design, right? So one of the goals we wanted to accomplish through DASH is also invite the research community to come to DASH early and often, so that when they're just starting to think about what their designs, what their study should look like, what kind of sharing they would like to see, what consents that they need to put in place, agreements that need to be drafted, they can come to DASH at an early stage so that we can help them sort through these questions, as opposed to, you know, at the end of the process, realize that, oh, actually, it didn't work out the way we thought it would work out. So a lot of this is also about, study design kind of support as well, not so much in the methodological sense, but in the process side of things, right? Making sure that the process would work the way that the researcher or the research team has envisioned. Now, I think the other benefit that we think, and this would take a little bit longer to realize, but the idea that as the centers work together and as we learn about each other, processes and requirements, there's also a lot of opportunities to harmonize ways that we do things. We probably some of the ways that certain centers do things is not necessarily logical. It's just how it's been done in the past. And, you know, it's really giving us an opportunity to kind of form a way to dialogue with each other and understand why we're doing things a certain way and how we can kind of improve each of our processes. And over time, we would like to look at streamlining and automating as well. And I coming to Meriç's point as well, I think, Meriç had talked about the need to streamline access, looking at privacy and security, looking at data sharing. And these are all the same thing that we're trying to do here, but maybe more at a multi-jurisdictional level. But it's the same challenges that we're trying to deal with in terms of streamlining access. So this is a DASH website, and there's a couple links that I'll provide later on, but essentially this is the first place that you can go as a researcher if you're interested. It's pretty straightforward, hdrn.ca, and you'll be guided to DASH. And on this website, very quickly within the last 12 months or so, we're able to put in 3 inventories that we think immediately should be quite helpful for for the researchers. One is an inventory of all the data assets that are available through our partner data centers. So it's a huge list of data assets. It would take some time to sort through, and we're trying to kind of increase or improve the search functionality, because it is hard to kind of sort through all of the data sets that are listed in it as inventory. But this is probably one of the first time in Canada that we have such an extensive inventory that are located in one place for a researcher like yourself to know what's available across the country. As well, we have an inventory on algorithms. So the data set is one inventory. The other inventory is to look at some of the established algorithms or definitions that's already been validated through feasibility studies, for instance. So again, if you're interested in, say, do a study in depression and you wanted to know how people code or define depression cases, right? That's a place that you can go to do a search and see how other studies have already kind of sort through this type of work, right? And whether you can replicate, you can add to it, like it's an opportunity for you to look at the work that's already been done. And then the third inventory is an inventory on data access requirements and procedures. So recognizing that every center has a different way of providing access and different steps that people have to follow, we have provided a high-level kind of table documenting for each province. If you're looking at data access in each of those provinces, what are the high-level steps that you need to follow? So it's not meant to be detailed dig deep, comprehensive, but at least you get a sense of what are the stages that you need to go through for a data access request. And as well on the website is the request intake form. So if you're interested in, accessing or requesting data, that form would be your first point of contact with us, so that you can, list your project, what type of data sources you're interested in, check off the provinces you're interested in as well. And that intake form will be taken over by a CAI-HI, our CAI-HI staff for DASH, and we'll triage it, and we'll kind of get going with the centers in terms of providing you with the answers that you're looking for. So really invite everybody to go and check out the website. And of course, during this time of pandemic, of course, there's a lot of interest that came through from DASH around COVID-19 data. So through HDRN, we already have, I think, 5 provinces, 5 jurisdictions where we have COVID-19 testing data available for access. So again, on that website, you'll also see a link to COVID-19 resources. And we also provide a page in terms of each of our data centers, what are some of the COVID related work that we've been doing. So for instance, like CAI-HI has an intervention scan that we've done and policy scan that we've done since the onset of COVID. And that material has a link from the HDRN website. So if you go to the HDRN website, look for the COVID-19 resources, you'll be directed to the different resources that are available from the partner data centers. And then this is going to be my last slide, but essentially just giving everyone a sense also in terms of, in addition to processing and managing the day-to-day of request intake, there's a couple areas that the DASH also want to focus on in the short and medium term, right? So one of the things, for instance, we're looking at doing or developing is a common data request form. So this is going to be a daunting task, but this is also something that we've heard loud and clear from researchers, is that it's very painful to complete every data request form from every data center, right? That in itself is very problematic and it's a huge burden for researchers. So we're looking at how how feasible it is to come up with a common data request form and making sure that this is a form that can capture all the information that would be required by the different jurisdictions. And maybe that's something that eventually could be used across the data centers as well. It's an aspiration. It's going to take some time to do, but we're looking at doing that. Indigenous data access policy. So this is an area, and this work is almost complete. So again, with the interest, but also the challenge in accessing Indigenous population-related data. One of the things that we've been doing in the last couple of months is document across our data centers, each center's data access policies and requirements around Indigenous data or Indigenous-related data. And then we're cataloging it, documenting it, and it will come up as another inventory on the DASH website in the next couple of months. And we know that in each of our jurisdictions, there are pretty specific, consultation, engagement requirements, and also approvals that are required for any type of Indigenous-related data. So hopefully that would be a very useful resource for researchers when it becomes available on our website. We are also looking at data linkage, data de-identification. These are all kind of key areas around producing data or accessing data for analysis. And we know these are areas where things are done quite differently from center to center. So by working together, we need to understand, and we want to understand how each center does data linkage, and how do we define linkage? How do we approve linkages? And also, how do we de-identify data, right? Because it really doesn't make sense if you're asking for 3 different provinces of data and we each identify the data differently. They're not going to be useful for you. So it really comes into light many areas that we can look at documenting and then aligning where possible. And as well, we within the network, we also have a group that are very much focused on privacy and legislation. So we have privacy experts within the network as well, and they're actually working quite hard in documenting and collecting information around privacy and legislative requirements in each of the jurisdiction in terms of data access, right? Because we really need to understand over time, what are some of the real challenges in accessing data and what are some that are just, as a product of habit or how things have always been done. So they're sorting through that. As well, we have a technology group within the network who's also looking at, if data is still going to remain distributed, what kind of analysis or what kind of technology could support doing work in a distributed manner, right? And some of this is looking at potentially common data models that might be helpful and that might be useful for us to contemplate and to make some investment in to facilitate that kind of technology and analysis going forward. So these are a little bit longer term aspirations, but just to say that, we do have a plan to cover, different aspects of the data access process that are currently, pain points for our researchers. So with that, I'll end here. On this page, you'll see many different links there, but if you have any questions or, just wanted to ask or find out more about HDRN and about DASH, feel free to use that email and your inquiry will be directed to either the DASH services or the network itself would be able to answer your questions.
Thank you so much, Juliana. Yeah. That was amazing. So much information that has been great to share. I know you have a hard end when you have to leave and exit our panel discussion here. So I'm going to ask Colin Caberno and Sandy Cassier if we could bring them all. Colin will have the first question and Sandy's actually tag teaming onto his question. And I'm going to, again, just remind our attendees to please introduce yourself and where you're from, who you are. We don't need any of the sordid details, but just definitely a little bit so that Juliana knows the perspective that you're coming from. But thank you, Juliana. I'm going to turn it over to Colin at this point.
Hi, Juliana. I'm a patient family advisor and a retired physicist and worked in IT for many years. So I was interested if you had looked at all at the open data movement principles and the open science movement principles and whether this would actually incorporate those.
Yeah, and I think that at the network and especially our executives are very interested in those type of developments. And I think for us right now, the very concrete challenge and barriers is the legislation and the policy barriers that are in place, right? The whole idea of open data really has to go into, it's broader than that. It's like a new mindset around trust, right? Like a trust in using data. And at the moment, I think depending on which provinces you're talking to, there's different understanding of, what that means. What do you mean to trust your researcher with data? What does it mean in terms of risk and risk management? But certainly it's a slow moving goal, but we are kind of moving towards that. And I think part of the goal for the network is to have those conversations, right? Like in each of our provinces, the privacy commissions, the data stewards, like those are the people that we need to speak to. And as a network, probably we have a little bit more weight to have those conversations collectively, right? As opposed to each province trying to tackle it separately. So, but certainly, yeah, those are things that are on the minds of our executives for sure. Thank you.
Thanks, Colin. It's great. I didn't recognize the name, but great to see you again. It's been a few years here, and nice to see that you've joined in, and excited to have your voice coming through in this conference today. So thank you and hello. I'm going to turn it over to Sandy Cassier now, who wanted to tag team onto Colin's question and elaborate a bit more.
Thank you so much, Dr. Wu. My name is Sandy. As Elan mentioned, I work as a research analyst at the Saskatchewan Health Authority in the research department. My question was about the requirement or the criteria that are needed to register the account to use the DASH network. I get a lot of questions from residents and clinicians who want to gain access to provincial or national data. So I was wondering if there's any requirement presently on this. And if you could just elaborate on how we could get access to that in terms of from affiliated institutions that we work with. Thank you.
Yeah, so thank you for that question. So I think on your DASH, on the DASH website, if you want to submit an intake form, you do have to register for an account first, but the registration is really quite simple. Like there's no criteria necessarily. I think, you just have to be from, if you're from an academic institution or from a research organization, there should be no problem for you to be registered. And then from there on, you can take advantage of the inventory and the intake form and things like that. Now, when it gets to actual access to data, then I think, at the end of the day, it would have to come to each of the data centers eligibility criteria, right? So certainly like academic research, again, is not an issue because we are looking to serve exactly this type of community, right? It's the academic research community. If you're coming in from the private sector or kind of market research organizations, then that would become quite challenging, right? Because at the end of the day, we need to make sure that the intended use of the data and the requesting organization, however they want to use the data is aligned to our mandate, each of our data centers mandate and our vision, right? So for profit, for instance, would be quite challenging to get through, but academic research would not be an issue. So, and if you have any problems with that, just send a note to that email address, info@hdrn.ca, and we can help you through that process.
Thank you so much.
Yeah.
Great. Well, thank you, Juliana. That's wonderful. We have a few things for requests for information in the chat room, but we can easily deal with that as a sidebar. Yeah. But thank you. I hope I felt super informed, and I'm sure all of our attendees felt the same way. So thank you, Juliana.
Thank
you.
And
attendees, again, hopefully you've seen the contact information, and I'm not sure, I know I'm not speaking out of term. If you have any questions, as Juliana said, just please message her, and let's move forward with our access to data here. So lots of great information, and thank you, Juliana. Invisible hand claps. Okay, hang on, I know how to do this. There we go. There we go. We've got a few claps coming up. Awesome. Okay, thank you. And we're going to turn it over to, I believe, if I am not wrong, is Jill Strachan.
Mm-hmm.
All right, I'll turn it over to you. Introduce yourself and all the wonderful credentials and affiliations that you have, Jill. Thank you.
Hi, folks. Hang on a sec here. I just got to get rid of this for a minute. I think I'll talk first. So good afternoon, everyone. And thanks to Elan and the team for inviting myself and Juliana to come and share a little bit about what's happening at CIHI. I'm the Client Affairs Manager for Saskatchewan and the Northwest Territories. And what that means is I work with the folks in the jurisdictions to help them get what they can out of CIHI and the kinds of products and services we offer. And I think more importantly, my role is to find out and hear about what some of the data and information needs are in the jurisdictions that I work with, and help ensure that some of that information comes back to CIHI in terms of how we provide products and services that are relevant to your data and information needs. And one of the key things that I find in my role is, and certainly with a lot of the folks at CIHI, is we truly are very much need to work in partnership with our stakeholders and the people in the system. We can't do what we do without that engagement and having the data come into us, but also work on so many aspects of providing high quality data. So anyhow, so I've been asked to talk a little bit about just at a high level some of the data that is available at CIHI, and then also spend a bit of time sharing with you how you might be able to get access to that data. And I don't know how many of you know who CIHI is or what it is we do. So I thought I'd start by just giving you the 411 on the on our organization as well, and then get into more detail with the data access piece. So hopefully that will answer some of your questions today. So I've been fortunate to work at CIHI for the last almost 30 years since its inception, and it's been a really exciting journey on health data in Canada. And probably I'm just going to switch over to my presentation now. I think it's been exciting to see the progress that we have made in the country. And there's certainly a lot more progress we need to continue to make, I think, with respect to data and getting it out into the hands of the people that need it. So let me just go to the next slide. So our organization was put together by the federal and provincial and territorial ministries of health. We're a private not-for-profit organization, but we receive the bulk of our funding through government funds, and we have what we call bilateral agreements in place that define what sort of services and products we will offer, and in return for X amount of money that comes into us. Our budget is roughly 115 million. About 80%, 85% of that funding comes from the federal government. The rest comes from provinces and territories. And, that's because the reason for that sort of imbalance is because the provinces and territories have an in-kind contribution in terms of being the people that collect the data, process the data, send it to us for processing at a national level. So there's a lot of infrastructure that they need to put in place, and that's why you'll see a bit of a difference in the funding arrangements there. These bilateral agreements within them, as I mentioned, they define core services, and I'm going to talk a little bit about that today, how it reflects on, people's ability to do data requests as well as pay for such data requests, because I know that's always a topic of interest to people. But there's a number of different functions we perform within the organization. I think the one that's closest to my heart is this provision and development of national data standards, because if we really want to be developing and looking at pan-Canadian comparable data in order to identify things like best practice and improvements to the health system, we really need to have data standards. And it's not a perfect world when we talk about data standards, as I'm sure some of you may already know. But we certainly have data standards for a number of different data sets, about 30 different ones in total here in CIHI. And those standards are important to us to be able to measure the quality of the data that we are making available in the system. And certainly better understand how the data we do have can be used for decision making. A second area where we provide quite a bit of tools is the e-reporting tool systems, standardized methodologies, such that when we are comparing data and developing indicators, that those are the aim with those is to allow for pan-Canadian comparison. So we have quite a large department that focuses on indicator development and data development, and allows and puts into a number of different e-reporting tools and old-fashioned, paper reports, but in a PDF form that you can get now, those kinds of things that are available on our website. And then lastly, we spend quite a bit of time, obviously, trying to support stakeholders with adopting and using the data and information. And this is another area that I have quite a strong interest in, and always wondering, I started my life as a researcher at StatsCan and produced innumerable research reports, and always wondered, was anybody actually using those reports to do anything within the health system? And so CIHI spends quite a bit of time, I think, trying to make sure that the analytics that are coming out are aligned with health system needs and requirements. And to that end, we do engage considerably with some strategic panels and different advisory committees and consultation groups to try to make sure that what we are planning to provide is relevant, and that we're also providing some capacity building tools to help support adoption and use. So that's sort of our high level. I also wanted to comment just briefly, for us, we have two very foundational components that really are important to CIHI in terms of us being a viable entity. And our data quality and information program is very central to a lot of the work we do, not just in when we produce reports, but also how we capture data, process data, report on data. And then also the privacy and security of our data. And we are a pan-Canadian organization. Our principal headquarters are in Ottawa and Toronto. As such, we do have to follow the Ontario legislation, but the legislation, or sorry, the policies and frameworks that we have in place for CIHI are very much based on a pan-Canadian look at the policies and requirements from privacy and security of data. We also are consistently audited by the auditor in Ontario and also by Health Canada around our policies related to data and security. And lastly, we do have data sharing agreements in place with most of the jurisdictions, and we do have one in place with Saskatchewan, and that helps us understand the way that we can work with the data that comes to us from Saskatchewan and make it available to others. So I just wanted to make sure that I commented on those two things. So let's talk a little bit about the data that we do have at CIHI. And are those pictures showing up, Elan? Do they show up on the screen? How do I get rid of those? Let me just see here. Hang on.
What do you want to get rid of? I see pictures, but I'm not sure.
There you go. No, that's okay. It's all good. Okay. It's all good. So as I mentioned, we have about 30 some odd data holdings at CIHI. Most of the data that we have there obviously comes from the people that we work with in the health system, and it's primarily administrative type data. Although we do have in some of the newer tools like our mental health, home care and continuing care tools, those are really clinical assessment tools that also allow us to produce from that data things like quality of care indicators and some of the resource grouping for specific types of patients or clients that are in those facilities. And those grouping technologies are really, our methodologies are the same as what we have with our acute care inpatient type grouping categories. So we also have a couple of survey related projects that we're involved with, but because of StatsCan role around surveying in Canada, it tends to be that CIHI stays away from the survey end. The two patient experience survey project that we have in place for acute care is one area where we are bringing in survey-based data from people across the country, as well as some projects that I'll talk about a little later on are from the Commonwealth Fund and groups like OECD and other international firms. So, I also thought I would talk a little bit about some of the areas we're doing development work in. And I know Brandy Winquist was interested in me sharing some of this stuff. One of the largest projects we have underway right now is something called our Shared Health Priorities. And this particular initiative was based on funding that had come from the federal government to the provinces and territories to improve access to mental health, continuing care, and home care services. And in Saskatchewan, they are participating in this project. And as a result of that, as part of trying to monitor whether access is improving because of this funding, they had asked CIHI to work with the jurisdictions on developing some indicators to facilitate that measurement and evaluation. So this is a multi-year project. It spans about 4 or 5 years, and it will result in us coming up with some new indicators and some new data to help measure access to care in those areas. We also have been working on electronic medical records and electronic health records in Canada, and looking at standardizing data and outcome measures in particular for primary care. We have a few jurisdictions in the country that have embedded the data standards there, and we have done some demonstration projects with selected groups where primary care physicians have been sending data into CIHI, and in turn we turn around and give them reporting and their ability to sort of benchmark across different organizations within their networks. So we're still, in Canada, I think, got a long ways to go in terms of being able to really drill down and use electronic data from our EMRs and EHRs, and part of that is because a lot of times they're not using codified data. It's very much a picture-based entity. And then, of course, COVID has resulted in us needing to do some changes both on the coding standards side to be able to capture information about COVID. And as well, we have started to do a number of analytical sets of work around COVID. And we actually have a release coming out in the next week or so around the unintended consequences of COVID. We do have a COVID splash page that you can go to on our website, and on that splash page, you'll find access to COVID-related data and information. Juliana had mentioned our policy intervention tool that's up there that you can track what policies were implemented and when, which I think will be very helpful when we start to get more data coming in that will allow us to do that sort of evaluation of policy interventions. As soon as we can get data that relates to COVID, we have been working with our partners to get that data up on the website. Sometimes this can be a bit challenging because of the requirements for data to, in order for something like an indicator to process, sometimes you need a full year of data in order to be able to produce that indicator. But check out that COVID web page. You can certainly access a number of different data sets on that page. And then lastly, one of the areas that we are seeing a lot of interest in out of the COVID pandemic is the use of virtual care. And we are moving into a sphere of work after Christmas on sort of looking at what data we might be able to capture around virtual care, and with the aim of understanding not just how it's being used currently, but also evaluating its impact on health service delivery, health outcomes, these kinds of things. So there's quite a bit of data development work going on, not only within CIHI, but in partner with some of the other groups like Health Canada, Public Health Agency of Canada, and Statistics Canada. So, and what I did was I just put a slide in here for those of you that might have interest in some of those shared health priority indicators and when they might be available. But I'm not going to go through the whole thing at this point. So in terms of data access, there's lots of different ways to get at data from CIHI. And oh, actually, sorry, I should, let me just go back to, damn it. Oh dear, sorry guys. Hang on. Do this a little smarter. On this data page, I didn't point out this box down in the bottom. I just wanted to let you know that on our website, and you've got the URL link there, you can go in and look at which of the data holdings each province participates in, and whether or not there's full or partial data. This particular data tool on our website, or metadata tool on our website, I mean, is, will give you that sort of snapshot view of where there is pan-Canadian data, comparable pan-Canadian data available for each of the different types of data holdings that we have at CIHI. Okay, so let's just go back to that. So I mentioned earlier about the bilateral agreements, and also about the fact that we have data privacy and security policies and procedures that govern who can access the data that we do have available at CIHI. And I just wanted to explain the difference between public and private, because I'm going to use that a little bit when I talk about some of these e-reporting tools and the data request process. So a private means stakeholders who actually provide the data to CIHI, and these typically are primarily ministries health and health authorities. However, it can also include data providers like the Registered Nurses Association. It can include non-publicly funded facilities that are providing things like home care, or sorry, long-term care services, these kinds of things. So we have different access to the e-reporting tools depending on whether you're considered a public or a private person. So a private person is someone that works for those particular organizations, and that means you're actually employed by them. If you're a researcher that is working out of the university and you're affiliated with someone at the health authority, I would be, thinking about your access via a person that's employed, as opposed to a researcher trying to make that request for data. So there's a little bit of a difference, and it's not that people can't get at data at CIHI if you're not part of a health authority or a ministry or health quality council or whatever. It's just that there are potential charges associated with access to that data. And those policies around cost and everything are available on our website. But typically our goal is to get the data into the hands of the people that are working in the system. So I'm just going to go through the next set of slides and talk a little bit about some of the ways you can access the data. We do, if any of you have been on the site before, we do have a lot of analytical reports that are available there. This is a splash page from our prescribed drug spending report. And typically with these reports, we always have a data table category on the link side so that you can actually go in and just download the data associated with that particular report. Sometimes I find in the reports it may not present a full pan-Canadian picture, and that may be based on challenges with not all provinces and territories participating, or it could be that there can be small cell size issues, but that it also doesn't mean that that data is not available. So if you ever want to get a breakdown by province and territory and you don't see it in the report, then you can contact our data request area to have that conversation. So, but typically with any reports that we produce, we want to make sure the data is in there, and we want to make sure it's available in different formats. So everything from things like the infographic you see here to basically data tables that are in Excel. We also have a number of e-reporting tools, and I'm going to cover a couple of these, or all of them actually, in sort of a high level, and just give you a little bit of info about them. These are all available through our website. All of our e-tools have the data in them have been de-identified, and in most cases aggregate to nothing lower than a five count cell. And the only difference with this is under your health system, and I'll explain a little bit more about that when we get to that page. So the indicator library is something that is really useful if you're trying to get a sense of what kind of measures are available from the data available at CIHI. This particular tool has been built around something called our health system performance framework. So that you can see where I've got the red circle there, if you're looking at doing a project and you want to understand what sort of measures are available around appropriateness and effectiveness of care, or around quality of care, or around efficiency, you can kind of search on those different topics, and up will come your list of indicators, and whether or not what the level of data is that we have for that provision or for that particular indicator. And you can see the reporting levels over to the right there on the screen, whether it's involved at the national, provincial, territorial, regional, or facility level data. This particular tool is really handy as well, because you can actually click on the indicator name and get access to everything metadata related that will tell you information on the indicator itself, the evidence behind it, how frequently the data, or whether the data is there, and the available year. And it also has a hot link right into the data itself, so that you can access and download that data in a way that is usable for you as a researcher. So this is a really good tool for just learning about what is available in terms of your research question. And it's also accessed, you can access it in a couple of ways. One is just go to our search tool and put in health indicator library, or you can also access it through this particular tool that our Your Health System website. It's also used as a reference on this particular website tool that we have. So the Your Health System tool is something that we came up with 5 or 6 years ago. It's structured around a series of indicators that have been agreed upon by the jurisdictions that we will report publicly at the facility level where appropriate from a data and statistical perspective. Typically, CIHI doesn't produce facility level data because of it's not a legislative or requirement, but it is a policy that we have in place in order to try to free up more data available at a facility-based level. We put this in place, and we've undertaken appropriate consultations with the relevant people to be able to make this available. So I don't know how many indicators they're up to right now in here, about 30 some odd. And people are able to go in and look at that data. You're able to do slice and dice. You can do analysis and look at some of the features can include, looking at trend information, doing peer comparisons, understanding volumes, using graphics. There's lots of different ways to slice and dice, and you certainly have an export capability within the tool as well, where you can export data directly from this tool and use it any way you feel you'd like to. And you'll notice on the right-hand side, there's a section there called Insight. And this is this area is just for people who we classify as private members. And that's because it can get into some really in-depth measures. And in fact, there is an ability within the Insight tool for people who work in the health authority to be able to access record level data with chart identifiers. And they need to have permission from their organization and be able to get into that level of detail, but it's there to help assist with quality improvement work, such that, when you're looking at something like the hospital standardized mortality ratio and you want to understand what's contributing to your mortality rate, and you want to be looking at outliers, or is it is that mortality centered in a particular area in question in terms of health service delivery in the hospital, you can do that. So, but typically that's not an area that we make available to people in the public. And yeah, so we also have something called our quick stats. This is just on the website. Anybody can go in and take a look through the tables that are there. Some of the tables are already pre-formatted, really just Excel, and you can download them. Some of them are a little bit more interactive, so you can select some things like, jurisdiction, year, those kinds of sort of high-level crosstabs. And this particular tool is under development at CIHI, and we're looking at I think a little better way to be able to access this data, and not just the data, but also some of the information and reports and things that might be associated with a particular theme that you're interested in. So that work is still under development, but in the meantime, you can certainly access the data tables there. And those data tables are updated on a regular basis as the final end of year data is completed. So the next tool that is on the website as well is our patient cost estimator. And this is primarily for hospital-based services, and it links the clinical and financial data to help you understand efficiency levels, as well as you can do comparisons across the country. Again, you can download data from this, and it doesn't require any, form filling out or anything like that. You just basically can go in and do whatever you like to do. We also have a similar kind of website on wait times, and this wait times data is a standardized set of data that we work with the provinces and territories on capturing this data for selected procedures and services. And these procedures and services are agreed on by the provinces that they will, try to make sure that they're getting the data into CIHI at a reasonable time such that we can produce it. And we do have an overarching advisory committee, but you can actually access and export this data as well from the website without any kind of access requirements. So some of the international tools that we have something called our OECD, and OECD is the Organization for Economic Cooperation and Development. And CIHI participates in this on behalf of Canada, and we provide data to them from the data holdings we have. And then we usually do a release when OECD releases the data, and we put up on our website this particular interactive tool, and you can go in and look at inter-country differences on a number of measures, related to health expenditures, healthcare activities, and the social determinants of health. So, and then we have our Commonwealth Fund surveys, or another source of data that you can get at through survey base that we really just can't get at through administrative data. And we work with Health Canada and StatsCan on facilitating the Canadian content to these particular tools. The Commonwealth Fund, you can search on their website, and they produce a couple of different surveys, one around older adults and how they're accessing the system. We recently just did the one on primary care physicians, and in that particular survey, they were looking at everything from access to care to, what sorts of plans physicians have around using technology, or, whether or not they're doing things around connected care, integrated care, planning, those kinds of subject areas. So anyhow, these particular surveys, their data is available on the website as well. You can just click on the link and download. And if when you're looking at it, you think there is more detailed data you would be interested in getting, it will depend on the sample size that they've used in the jurisdiction in question. So some jurisdictions, you may be able to do a bit more of a deeper dive, but in other jurisdictions, you may not. And typically that gets coordinated through the Commonwealth Fund group, even though there's a reference to it on CIHI's site as well. And lastly, in terms of data access, I did just want to mention Statistics Canada. I know we don't have anyone on this panel today about StatsCan, but we do work closely with our federal partners, and there are a number of sources there, or places to go to access data. Some of them, some of you will probably already be familiar with these. The Health Indicators e-publication, that's a product that CIHI works on jointly with StatsCan. And the indicators that are in there they're the same indicators that may be in our YHS or in our Your Health System web tool, as well as the Health Indicator Library. But there could also be some indicators that we don't have at CIHI that StatsCan also includes. But we always make sure that particular offering is synchronized in terms of having the same data measures in both where applicable in the same year of availability. We also participate with StatsCan on the Data Resource Center, and I know Meriç had mentioned earlier about data sets that you can use to take a look at whether or not it fits your, what you're thinking for your hypothesis or your research plan. CIHI has supplied de-identified data to the data source centers to facilitate that kind of work for things like the acute care data and the emergency department data. There also are some linked data files between the Canadian Community Health Survey as well as the DAD data and the NACRS data. So definitely you can check out those sources as well. And your point person at CIHI on any of these data request tools or access to data will be Juliana. She's our data request wizard. So those are some of the e-reporting tools that are available, and they're there anytime. You don't need to fill out forms. You can go in and look at the data. They can be really useful for understanding or helping you formulate what might be something to look at for your hypothesis or your thesis or whatever. I think the other thing that's on the website that's really, really useful is we have a lot of metadata available on the website, and I'm going to talk a little bit about that through this next section around, how do I get at that data that is not available in an e-reporting tool or accessible. But even with the e-reporting tools, we build the metadata into the tool, and there's also a way on our website to pull down things like what are the data elements, what are the data quality reviews of that particular data holding, the privacy impact assessments for the particular data holding are available, and there's certainly a lot of ability to contact CIHI directly through the help function to get more information if you can't find what you're looking for. So the metadata part is really a really big part of a byproduct sort of all that work we do on the data quality end and the processing end. And you can get at it through that Access Data and Reports tab that you can see on the screen right now. So I'm going to finish up with a little bit on the data request side. We have a whole section of our website available there that you can go in and fill out your data access request form. And typically, people going in here are looking for data that either they can't find on the website or they're looking for record level data, or it's aggregate data, but you just can't find it anywhere. So definitely go in, fill out the form, and somebody on our team will get back to you within, usually it's 24 to 48 hours. They get back to you and they'll tell you, we have this or we don't have that. I would always encourage people to have a phone conversation with them as well, just to talk about if it's a project you're doing, to really understand, what's the project you're trying to do and whether or not the data that you think will be useful is actually going to be useful and tell you what you want. And that's because you can, we may have data on acute care, using DAD, using standards, but maybe the question you're trying to solve, that isn't the right data set for you to be using. So it's always really important, I think, to have those conversations about what it is you're trying to do and how and what data is the best to be able to use to do that particular project that you're trying to begin on. And if you're someone in Saskatchewan, you don't know where to start and you're a little concerned about calling the CIHI help desk, you're always welcome to get in touch with myself. I have worked with a number of the researchers in Sask to actually do similar kinds of conversations, and it's just a way to sort of help figure out, what's going to be the best approach for the work you're trying to do. And it could be that it's not even data that we have at CIHI. It could be data that comes from somebody local. You're probably all sitting there wondering, well, we've got the DASH, we've got the CIHI, we've got, what eHealth's planning to do. How do I know which data source I should go to do my request? And I think because there's actually, like, the eHealth folks do have the DAD data available there. The DAD is the acute care data. They do have the emergency department data. So any of the data sets pretty much that we get from the health system in Saskatchewan, eHealth also has those data sets. And similarly to what Juliana was talking about in that particular data platform, they will also have, obviously, any of the data we have at CIHI is in that platform as well. I think where you can see some differences is Saskatchewan also has a lot of local data that we don't have available at CIHI that may be pertinent to the work that you're doing. So there can be duplications, and in all cases, we try to make sure that that data is consistent across all of those platforms. So I talked a little bit about methodological notes and metadata repository. You know, certainly make use of those so you can really understand the fitness for use of the data that you're planning to use. And so you can reach out to our CIHI experts as well. Here's the metadata site. For all of these slides, I've just tried to give you the info so you can actually go in and look at it yourself, as well as the URLs. And then lastly, just to talk a little bit about our graduate student data access program. This is available on our Access Data and Reports tab. And what we do is we work with people across the country that are in programs of advanced learning, and we will make data available at no charge to graduate students. It's pretty much at no charge. I in my time at CIHI haven't seen us really charge anyone for this program, but sometimes it'll depend on the complexity and the length of time that you're trying to get at the you know, what it is you're trying to do and how much time it takes for us to do it. So, but mostly it's pretty straightforward. You just go in, fill out your form, and then somebody will reach out to you and have those conversations about what it is you're looking for and you know, whether or not we have what it is that you need. And that's it. So I'll just put that down and come back up on Zoom.
Thanks, Jill. That's
yeah,
great.
I'm sorry.
No,
I know. It's a lot at once, and you know, I actually can spend probably an hour just on the data holdings themselves. So it's a lot to get into. That's why my name is up there with my you know, contact. Just reach out to me. There also are people within the jurisdiction that have a little extra knowledge. People like Meriç. And people at the Ministry of Health in particular, like Sheena McRae, and you know, there's a lot of content experts. I'm very connected in with most of them just because the data comes from you folks, and so we're constantly working on things like our data quality programs and better understanding the contextual setting around the data.
Yeah, no, yeah. Thank you, Jill. Like, and that's such a helpful presentation for all of our local researchers here. So while we wait for some questions to come in here, are you okay with people contacting you directly and then linking them in the province as Meriç moves to a new role? And sorry, Meriç. But what do you suggest? Like, what you know, as Director of Research for the Health Authority, I often get questions, and this would, you know, I have lots of things going on. Who would I send people to? Where's the best place to make a contact for all of our health services and health policy researchers, and even clinical researchers wanting to access health data? What would you recommend?
You can send them to me.
Okay.
I'm happy to do that. I think, you know, the more, I think there's, and you know, as you guys move forward with the data literacy program there, had conversations with Meriç about, you know, and Derek Larson about things like joint education training programs. Yeah. We have a number of education programs that people can access. If you're, you know, if you are employed in the Health Authority, Ministry, HQC, eHealth, 3S Health, there is an ability for you to go in and access those education courses and learn more about the data, the tools, the methods. You know, there's a plethora there. So I think we have talked about how CIHI can partner on some of these initiatives jointly with SCPOR and with the Data and Information Governance Group that Scott Wells had mentioned, the Data and Analytics Oversight Group. So I think there'll be more to come on this front. You know, happy to do if people are in a particular organization, I'm happy to work with folks and do more detailed dives on some of these tools and or data sets, if that is something people have an interest in. So yeah, just feel free to connect with me. I'm always open to help out if I can. Yeah.
Thanks, Jill. Sandy Kasser, I'm going to take it back to a question you had earlier, and maybe you've had your question answered, but it was really talking about access for the access to data for the novice researcher, someone just coming in at the ground level, not knowing where to go, not knowing what to do. We've had some really amazing presentations about the breadth and the depth of data access that's available. Sandy, without putting you on the spot, I'm going to call you up here again and see if you would like to elaborate and or whether you feel like your question has been sort of resolved.
Maybe she's not there anymore. Or she's on mute. She's still on mute.
So I'm going to read Sandy's question here because it went right back to right after Meriç had finished his presentation. So Sandy had asked, I see her on her. She just looks like she's muted here. Oh.
Sorry, I had trouble unmuting.
That's okay. Take it away, Sandy. Thank you.
Thank you so much for your presentation. And I just had a question about resources and databases for novice researchers, especially for those who would like to engage patient partners in their research. So I would welcome any information you provide me. Thank you so much.
Yeah, I think when you talk about novice researchers, if I think back to when I was a beginning researcher, one of the best things you can really do is learn about the data that's out there. And I think there's the tools that I mentioned around e-reporting, like the Your Health System tool is great because we've geared it to a public audience. You can go in and look at the different topics in there and start to learn a little bit about the types of data. And certainly, you know, just exploring virtually on our website is really good. Like, I'm always amazed at how much data there is available out there. And a lot of people just don't know that it exists. And, you know, the other thing I'd suggest is create partnerships with a mentor or someone that has been a researcher or even a data person like, Meriç, I don't know where we're at with this, but at one time we used to have the Cheyenne network. It was sort of an analyst network in Saskatchewan, and people could, you know, jump in and join that network, and there was access to tools. There was a forum to ask questions. There was questions being like, say you're working on your research project and you're not quite sure what data you should use or what methodology might work best. You know, there's those kinds of forums that you can join. But I think the number one thing is just understanding or trying to figure out what kind of data there is available and where does it reside. And, you know, it's a good way to sort of grow your thinking around, you know, if you are working jointly with a policymaker or a clinician and they come up to you and they say, well, you know, this is what we want to, this is the policy we want in place. How do I get at the evidence to support that policy? Then you have a much broader set of understanding of the different types of data that you might need to be able to, you know, create that evidence base around policy development. So, yeah, those are some ideas. I don't know if Meriç, you have some other ones. You've been through the research development in Saskatchewan since you joined 10 years ago,
No, thank you, Jill. I think you've covered it very beautifully. So a couple of the things that I would like to add, Sandy, in terms of you know, the pieces that Jill has shared, I think as we are starting, you know, everybody starts from some point. I think it's really to understand what data is available out there, and especially understanding, you know, of course, the research and the questions that you have. And sometimes those databases, you know, are available or closer than sometimes we might think. So, for instance, you know, there are at University of Saskatchewan, right? We have the Research Data Center, StatsCan. it provides access to patient level data to multiple surveys. So that might be one option in terms of, you know, when it comes to survey data, and those databases at some level available, I think with a small fee, which we call kind of like the dummy databases, but really mimics and or micro databases that are available through Stats Canada about multiple surveys that has been done multi-jurisdictionally in Canada. And also depending on you know, those questions in databases, some are you know, there's more challenges to access to them compared to the others. But I think one of the things, especially when it comes to patient-oriented research, is one of the things that we want to facilitate, and we want to support researchers that are starting or really seasoned with those conversations. So I think you know, you can always reach the co-leads in terms of those questions, and we provide to the best to our knowledge where those databases might live. And one other thing that I would like to mention is that as time passes, we learn more as well. And SCPOR is growing, especially from a data perspective. We are finding new venues, we are forming new collaborations and alliances. So, and we are learning each organization's strengths more. So as we are moving forward, I think please don't hesitate to reach out to the co-leads, to Jill, as she has a very great you know, relationship with the province, and she knows what's going on as well, and to us that we will do our best to really navigate those waters together.
I'd also say, Elan, that you know, you can take a look, like, just if you're a novice researcher, like, just read through some of those reports that are available on the CIHI site. It'll give you a flavor for the kind of data that we have at the organization, and that's just a really great way to start, because you can actually read some stories and learn about the health system as well as the data. So, you know, take a bit of time, get yourself a coffee or a tea, and sit down and, you know, just have a read through.
Yeah, Jill, that's great advice. And, you know, I'm going to just sort of, I've got two questions here, and I'm going to try to squeak them in. The first will be from Mamata Pandey, and the next will be from Dinesh Darrell. But I'm just going to add a comment that on behalf of the Saskatchewan Health Authority, I can't tell you how many times we've had a research ethics board application come in. The board really doesn't know what data is available. The protocol has been approved only for the disappointment of the researcher to know that information is not actually available, and or they had budgeted a research assistant to collect this by hand over, you know, a 4 or 5 month period to know that it's electronic. You're fine. This is like literally you know, a 2-hour experience here. So definitely, much like community-based participatory research, reach out to your data leads and get that advice before you finish your protocol. But I am going to call upon, that's just my little interjection here. I'm going to call upon Mamata and then Dinesh for two questions for our panel.
Sure.
Good afternoon, and thank you very much for all the information. I'm very interested in trying to use some of the data from the databases. I'm a research scientist at the Saskatchewan Health Authority, and I have had the privilege to access some data from CIHI.
Yeah. Oh, we lost her.
Let's maybe go to Dinesh right now. We're having, it seems like everybody's having some internet problems here, but Dinesh, and again, Mamata, if we get you later, you can contact the researchers later, but Dinesh?
Thank you. So this was a very extensive set of information that I'm receiving in the last few hours, and I'm very excited to know that we had the data available. So it's just that how to capitalize on that. And oh, sorry, I forgot to introduce myself. I'm a graduate student in community health and epidemiology in University of Saskatchewan, and I also work for Saskatchewan Health Authority as a physician. So my question is, do you also have some sort of support if a researcher requests for data, especially in terms of helping with data management and linkages, which is actually a very painful thing if we have to do ourselves? Thank you.
Yeah. Sure. So, I guess the answer is it depends. Obviously, at Ki-Hi, data linkage invokes a certain level of scrutiny that has to go through our approval processes right up to the VP level. We don't maintain linked data sets at Ki-Hi. We do have people that have lots of knowledge about data linkage and can always, provide some input if you're trying to have discussions around data linkage and how to set up methodologies to support linkage. The other thing I would say is it depends on what type of data sets you're wanting to link. If the data is all at Ki-Hi, then it's much easier for us to link it and give you back the set. If the data are one set of data or two sets of data are available at Ki-Hi, but two of them are available as local data, that doesn't mean that we can't get involved in that, but sometimes the better route might be through eHealth Sask. It'll depend on whether or not eHealth Sask has all four of those data sets available in their organization. So it can be a bit complicated in terms of figuring that out, but that's where someone like myself comes in. And I'm always happy to walk you through like what it is you're trying to do and talk about what might be the best solution for you. And keep in mind that there also is some linked data already available from StatsCan that's been de-identified. So this is where figuring out what it is you really need and what might be the fastest route to get that linkage. And I know Scott and his team, like in Meriç, they've been working on their data platforms to, I think get to that space where you have your data holdings already prepped for linkage. So usually you don't maintain them linked, but you process them to a state that makes it easy to link quickly, right? And that's what they do at StatsCan too. We have methodologies that you use to prior set up your data into analytical cubes or whatever, and then you can link. And so that's a very long answer, but my suggestion to you would be to, reach out to myself, reach out to Scott Wells, who, they're involved and can look at linkage in their organization. But yeah, just know that there is potential for that.
Yeah,
thank you, that's helpful.
Oh, sorry. I hate to cut you off there, Dinesh, but we are very strict Zoom timelines here. So this discussion has been good, but Jill, your final comments is to reach out. I think for sure with health data, it's one of those things you don't know what you don't know until you actually get knee deep in trying to figure out your protocol. So on behalf of the Planning Committee for Research Showcase, I want to thank Meriç, Jill, Juliana, and Scott for this amazing presentation. I think the dialogue is going to continue. I think this was like a really great foray into what's available. And thank you so much. I encourage all of our attendees, we had a great turnout today, to reach out to Meriç, Scott, Jill, or Juliana if you have